Reflex of the newborn. What are the reflexes? How the reflexes is occurring in the newborn? We can discuss in this unit. The first one is what is a reflex? Reflex is an involuntary response to the stimulus called a reflex. When we when the involuntary response is occurring, that can be stimulate our body, that can called as a reflexes. What are the reflexes can occurring in the newborn babies are one is sucking reflex, rooting reflex. Others are there we can see in the next. First one is the sucking reflex. Sucking reflex is ongoing on giving the sucking stimulation. Infant start to suck. How the sucking reflex, the infant start to suck when we giving the stimulation. Infant start to suck. How the appearance in sucking reflex is 14 weeks of intrauterine life. 14 weeks after the sucking reflex can occurring in the newborn. How the disappear of a sucking reflex is disappear at a 4 month. The sucking reflex is disappear in a 4 month. Next one is a rooting reflex. Rooting reflex is touching alongside of the mouth. Infant will turn his head to the same side and start to suck. When we touching the one side of the lips, then the infant will start to side on the same side, and that they can start to suck. It is called a rooting reflex. It appearance at 34 weeks of intrauterine life and disappear at 3 to 4 months. Next one is a swallowing reflex. Swallowing reflex is a neonate swallow after the sucking. After sucking, the neonate start to swallow. Appearance, why when the swallowing appearance after the 34 weeks of intrauterine life, born at a 30, when the how the appearance after the 34 weeks of intrauterine life. If there is a having a 34 and a week of having a born, is that can some of the can't to swallow well. The tonic neck reflexes if a head of the newborn quickly turned to the one side, then arm and legs of the same side extended opposite arm or legs will be flexed. When the head of the newborn baby is quickly turned to the when the head of the baby is turned to the one side, then the arms and legs are same side extended. When the same side of the baby is seen, that arms and legs are extended, the opposite arm and legs are flexed. This is called a tonic neck reflex. It disappear within a 3 to 4 months, and it absent in the brachial palsy. When the brachial palsy is there in the born baby, it is absent in the tonic neck reflex. It is if it is a reflex present after 6 months, it is called abnormal. But tonic neck reflexes, it is disappear within the 3 to 4 months. If there is a present in the after 6 months, it is called abnormal. Next one is a grasp reflex. We know about the grasp reflex. Grasp is holding anything object and put on a palm. The newborn is the same as a human, same as the adult. The newborn grasp it any object put on palm and soles. Present at a birth, the grasp reflex is present at the birth only, and disappear after the death. Disappear within 4 months and 8 months. Grasp 4 months and 8 months, it will disappear in the body. Next one is a Moro's reflex. Moro's reflex is one of the important reflex that can when we assessing the newborn baby assessment, it is one of the important reflexes. Changing the position of a newborn from a semi-setting position to allow the head and neck to the dropped back, then a rapid abduction and extension of the arm and framing of the fingers. When the framing of the fingers and abduction can occurring in the bone, it is called a Moro's reflex. It disappears within a 3 months. These are the reflexes are important while we assessing the newborn assessment. In many reflexes are there. We can see in the next videos. Thank you.